Professor Ganeshan sir, you know, he is a legend as far as the training programs are concerned. He's a world-renowned trainer. He's quite apt personality for our World Congress of Psychologists. And there is another patron, our J.V. Lakshman Rao. He is a Pitamaha as far as this media is concerned, press is concerned. So, like this, before stalwarts are here, I'm welcoming these two stalwarts as well as the so-called chief patrons who was my guru, and another chief patron is one among the 10 psychologists in the world. So another patron who is also from Aran Singh from Uttar Pradesh, a biggest state in India. Then other executive committee members and core committee members, and our beloved participants. And today, two VIPs are with us. One is chief guest Professor Stanley Vijay Kumar is with us. I think he might have joined. So he was our colleague in Venkateswara University. He was heading the sociology department. And another special invitee, Sunanda Ravi from Hyderabad. So she is our special invitee today. Now,
maybe we don't know the physical conditions, but due to psychological conditions, I hope I shared my knowledge clearly.
Thank you.
Thank you, sir.
Ravi, for your very brief message and short message. Though it is short message, is quite effective one. Now, I am just requesting our Professor Ganeshan sir to concentrate on the topic that is erectile dysfunction as today's topic. Thank you, sir. Please, sir.
Good evening, everybody, and good evening to Professor Govinda Reddy and Sri Lakshman Rao Garu and Dr. Rao and Dr. Sunanda Ravi and other participants. She has given a nice description of how the thinking or feeling can affect the body. So that is the crux of the matter, which is being ignored by the medical profession. So more and more psychologists should come into practice and they should help people. And some of the senior MDs always say it is the mind which creates the bodily problems like that. Because as we all know, it releases different hormones which affect the body. Now the topic for today is erectile dysfunction. There are two models. One is impotence and other is ejaculatory incompetence. They are just opposite of each other. Impotence means there are two types again. One is primary impotence, another is secondary impotence. Primary impotence is caused by any organic damage to the spinal cord, etc. Okay, but that requires surgical procedures for treatment. And the other one is secondary impotence is due to psychological factors, trauma and habits, etc. And that can be treated with behavior technology. Medicines will not help in the secondary impotence, though many people are resorting to medicines. And what are the causes for secondary impotence? First, it may be a trauma where a young boy is abused by an adult woman. Then the boy gets a shock, like a young girl is abused by an adult male. Same thing happens here. When the person doesn't like to have sex, they develop an aversion to sex. So naturally, the erection will not come. Structurally, everything is okay. The nerve and the muscle and everything is okay, but he will not get an erection even after getting married. And he feels, when he sees his spouse, he thinks she is an adult, because that is by way of habit. Because several times an adult has abused a young boy periodically at the age of say 10, 15, 18, like that. So when he thinks of sex, he is frozen. That's a problem. So erection will not come. And this is one thing. Another thing, a boy who is born with quite a few sisters, he gets an inhibition towards sex. Okay, he gets disciplined by himself, and they also have impotence. A family of 4, 5 girls and then one boy. And the boy gets inhibited, and then that affects his marital life. And sometimes they go without marriage. Maybe elder brother or younger brother or somewhere in between. This is also the case. And another thing is the masturbation by males. It also affects, and the erection will not be coming. Because masturbation is done with the imagery. But when they see a real person, they become anxious. That is the problem. Another type of impotence is person who is a womanizer who goes around having sex with many persons, girls. When he gets married, he has a sense of guilt. Then he also faints, and the impotence will not be. The erection will not be coming. And gays also, they cannot have a heterosexual relationship, and the erection will not come for gays. So these are quite a few reasons. And when people engage in incest, also they have a conflict, sense of guilt, and the secondary impotence will come. Yes. Yes, please. I'm not able to get you. Is there any crosstalk or something? Somebody's mic is on. Please switch off your mics. Okay. Okay. I will go ahead. And boys who are shy of women, okay, they have an inhibition in the mind, and they also have impotence, secondary impotence. And boys who are hesitant to look into the eyes of the opposite sex, they avoid eye contact. So possibly they will also have this impotence, secondary impotence they may be having. That is one way of diagnosing whether they have secondary impotence. They will not look at girls. So that is one reason. But at the same time, if they are masturbating, then also they will not look at girls. This is a problem. Because they will be afraid that their masturbation will be identified by the girls. So they have a conflict, and they will avoid the eye contact. And if people go for a delayed marriage, as far as possible, they postpone the marriage. And how to solve this problem? There are quite a few techniques. One is paradoxical intention technique, which will be very effective, better than any medicine or stimulant, like whatever they are using to stimulate. So what is paradoxical intention is, if they are married, you ask the couple to
Namaskaram, sir.
Yes.
Namaste, sir. Ganesh, sir.
Okay. So if the husband and wife are made to lie down together facing each other with a distance of 12 inches in between, and they should not touch each other, and the man is asked not to have an erection, because he may not be having an erection at all. But the moment you ask him not to have an erection comes. Within a 45 minutes period, we say you have to lie down, you should not speak, you can look, but don't speak, don't touch, and see that you don't get an erection. So the person says, I am not getting erection, but you should try not to have an erection. So when he tries that, erection will come. So if he is afraid that erection will not come, it will happen. That becomes a self-fulfilling prophecy. So he should intend the opposite. Opposite means he should not have erection. There is one very simple technique which will work, and if it is repeated again and again, you will have a full erection like that. That is one technique. Second is sensate focus. Sensate focus, I think I have already explained somewhere in this program. That is, because of the imagination and the trauma, their mind gets inhibited. So to arouse the natural response, sexual response to the partner, to the wife, what is required is close your eyes and feel the body of the partner by touch only from head to foot. First on the, in a prone position, that is the backside of the person, one can feel over the breast. And then face up over the dress. Both are done over the dress. Then sniff the body. So that is another sense. Okay. And then open the eyes and look very closely, not from a distance, very closely, some 4 inches away from the body. Go on scanning the whole body. So the information about the partner's female body goes to the brain by each of the sensory organs, by seeing, by smelling, by hearing the voice alone, by touch, by tasting also, licking whole body like that. As a result, whatever trauma the person has experienced, being abused by an adult woman when he was young, that becomes all right, and the person will become all right. And along with this, one exercise which is usually given in case of any inhibition or excitation, excessive interest in sex or lack of interest in sex, is to develop a control over the genital muscles. We ask the person to sit and close the eyes and contract the penile muscles, count from 1001 to 1006 and relax. And repeat this 20 times. And contract the anal muscle, count from 1001 to 1006 and relax. Third step is contract both the muscles, count from 1001 to 1006 and do it 20 times. So by this, there is a voluntary regulation of the penile muscle. And this is also a general procedure which can be used for both the genders who have got aversion to sex. Then, if there are any questions or observations, I can interact on that. Please come forward. Because next I will be moving to kind of excitation is too much. Okay, for that. Here there is lack of excitation. Opposite is too much of excitation, and those who are feeling too sexy. That is another aspect of erectile dysfunction. For them, the erection will not come down, and the lady feels a lot of difficulty. Okay, the erection goes on, and then there won't be any ejaculation. So women are put to difficulty. That we will come little later. Up to this, if you have got any question or observation, please come forward.
Hi, sir. This is Vinusha. So
Yeah,
there
yeah.
might be some cases where when they see even mother, for them it would be erected.
Pardon? I'm not
Seeing like mother, sister, like every woman, the moment they see.
That is opposite of this. So we will deal with it little later. Those who are not getting erection, who are inhibited, who are shy, only first we will deal with that. Then other things will go. That is another part. Next part is that. We'll go to that. So
Sure,
good question. Good question, yes.
Sir, the absence of testes can have because birth sometimes some people do not have testes, and also some people have one testes. So, what is the effect of the on the person who has erectile
That is a physiological deficiency which has to be dealt with by a medical expert. Okay. We are dealing only with the erection now. Even if there is one testis, they will have erection. Okay. Because that is the way they have to deliver the semen. So if there is no testis, then they will not have erectile problem. Okay, if there are no observations, then we will take up what Vinusha has asked. So we are moving in from inhibition to excitation, too much of interest, obsessive interest in sex. That is what she has indicated. That is the second part of this program. They get excited even at looking at the close relatives, and that becomes a problem for them. And sometimes they make a pass at the close relatives, which leads to molestation, raping, and incest. So how to solve that problem? Why it has come in the first place is because a lot of exposure to triplex videos, okay, through computer or through the laptop. They go into YouTube and they go into RedTube and other tubes are there. So they see actual sex performed by the artists. They are not actually relatives. They are only artists. Like in the film, they play different roles. By seeing that, they get excited and they have become too sensitive to look at the female body, even the fully dressed body of any female, including the relatives. So that becomes one of the problems for them, which can be also corrected. And if you come across any such case, please tell me some details, then I can tell, or I can give a case and then tell the solution. Please come forward. Have you come across such people? Vinusha, or is it
Yes,
a general
sir.
question?
It's not a general question, sir. He is maybe in the first year or 10th class. So
Okay.
even he sees his mother, he gets erected. So the background story to it is father is like a womanizer. He does that, and mother also knows it. And sometimes when the father does, he takes this children also along with him.
Yes, yes. Okay.
Uh,
Now,
So
basic recommendation for public health in sex-related problem is I would ask the child to be kept away when the parents are having sex. But sometimes unwittingly they have sex in the presence of the child, which they think maybe is sleeping, but actually the child will be watching. Okay. So it is one of the important things. They can have the child in the bedroom, but when they want to have sex, the child should be moved out to sleep with some other relatives, like grandparents. Okay. Or they should schedule the performance of sex at a time when children are not there. Otherwise, the child gets stimulated, whether it is a boy or a girl. But now, when the boy gets stimulated like that, so what he will do, he will try to touch his younger sister, okay, or sometimes elder sister also. And most of these problems happen within the family. They will not go and touch any neighbor because that is risky. But within the family, such things happen, incest happen. And how to avoid it? I will describe a case of an engineer who was about 25 years old, and he had the problem of touching his married sister, elder sister, and she started crying. Then he was shocked, and then he left it, and ultimately he hugged his mother. She was also shocked. Okay, and he had a temptation to get aroused, sexually aroused, whenever he looks at any woman on the street. And he got an appointment order to go to a city to be appointed, but he was afraid. But if he gets into any kind of affair like this, he will be beaten. So the case came to me and I asked him. Usually it is due to the media. Media means they look into written material, books are there, or there are stories also, sex stories in Tamil, Telugu, or Malayalam like that. Only stories are coming, and the pictures are also coming, mostly shot abroad, and some are shot within the country also. So by visually getting excited, they see certain relationships are being abused. The mother induces the son, or the son has sex with the mother, or the stepfather, stepmother, they have sex with the son or daughter. Like that, the story goes on. Own brother, own sister, all incestuous things are shown. By repeatedly seeing such things, the person's brain gets stimulated and looks for an opportunity, and they try it on their younger sister or elder sister, married or unmarried. And that is how it has happened. So here, I would like to warn people that we think that looking at videos will be exciting more. It is not true, because in this man's case, he was fond of looking into the written material, like a story, like that. So he was telling this is the cause. So what's the kind of treatment I have given for him is, okay, you look at a story, whichever is exciting to you. The younger brother has sex with the elder sister, or the son has sex with the mother. Like that story runs in any language. So I said, read one sentence and start laughing. Why I say is, when they read, they get sexually excited, and the hormones which are released into the blood are related to sexual stimulation. So how to stop it? It has become a habit. So this laughter technique, laughter therapy, is a sarva roga nivarani, which can dilute and divert anxiety also, aggression also, sex also. So I asked him to read one sentence. Say, for example, the line reads like this: sister was taking bath and the door was slightly open. The brother looks into that and he sees the sister nude, taking bath, etc. Okay, it goes like that. So read one sentence and start laughing for some time. Again, second sentence, laugh. Third sentence, laugh. The whole story, you keep on laughing after each sentence. So this is an elicited response. Technically speaking, it is an elicited response, not a natural response. But when the person starts laughing, the natural response gets inhibited. It's a very easy, very simple, very effective technique. Okay. And after, and this is a program which was given for 10 days. He was admitted and treated. So along with other programs like reduction of rate of breathing, genital muscle relaxation, which just now I described, contracting anal and genital muscle, etc. Along with that, there are so many other physical and psychological exercise, emotional exercises. Then after that, he was asked to go and sit before a bus stand and start looking at people who are going by, women. He found that he was not getting excited because there is a counteraction which happens at the brain level, at the hormonal level, and things become all right. After 10 days, he was discharged and he went away happily to join the job. Otherwise, he was afraid to go to a big city because there will be a flow of more girls. And if he gets tempted and lays his hand on somebody, then he will be beaten up. Okay, our police will take action. So he was afraid. So when we tested him, and he found that he was able to look at people and not get excited. So that is the way. So this is a very effective technique using the laughter therapy. And it is almost like hormonal therapy. We don't give any hormone. Some people give electric shock. That is not good. So this is a diversional technique, antidote. It's an antidote to sexual excitation. And even if a person looks at a video, triplex video, if he starts laughing, he will not get it. Okay. This also we have tried in some cases. But this man feels reading the story is more imaginative because when you look at a video, you cannot identify yourself with the man there. But if it is a story, it is only a word. Okay, the younger brother, then this fellow can easily identify. So it is more dangerous to read stories than to look at videos. So I'm not recommending to see the videos, but as specialists, you should understand that the written thing can create more problem. Okay. So you should tell people not. There are books which are available in bus stands, railway stations, and these people go and buy the books and start reading, and they start imagining. They can get closer to that area by reading than by seeing, because the models there are white-skinned or black-skinned or brown-skinned and from a different culture, like Japanese, Americans, Italians. It's not easy to identify. But when a story comes in the mother tongue, the brain acts very promptly and then gets excited. And they want to put it to test. So they go and try someone in the family. They won't try it on anybody outsiders. Okay, so it is a very high risk problem. And fortunately, the man was brought to me and then we helped him. And this is the technique. If at all you come across any case, you can use this. It will work, but you have to mix it with other relaxations or the muscle relaxation, mind relaxation, breathing relaxation. These are the three things: mind, muscle, and breathing. And one of the things is reduction of rate of breathing, which I often use. That is, breathe out, count 1, breathe in, count 2, then 3, then 4, exhalation, inhalation, they are counted, and then write down per minute what is the rate. Suppose it is 30, then divide it by 2, write it in the next column, n by 2. Serial number 1 to 10, 10 times ask them to do, and ask them to breathe out still slowly and breathe in still slowly. And as the progress, the rate of breathing will come down. Okay, if it can be brought down even to 3. First, if it comes to 5, wonderful, it's working. If they try, it will go to 3. If they further try, it will go to 1. You will be surprised, but it happens. And today, I have seen a case, treated a person with this technique, it has come to 111 all the time, 10 times. Okay. And if it comes, then the physiological arousal, whether it is anger, fear, worry, sex, it comes, but they know how to apply the brakes. So the moment the person starts breathing out slowly and breathing in, then things come down. Okay, surprisingly. Because when he breathes out slowly, what he is doing is pushing out the wasted gases which are in the blood, filtered by the lung. It is sex-related hormones which are there in the blood, which the lung wants to throw out. But if you breathe out slowly only, it will go. Otherwise, it will not go. Again, it gets recycled, gets into the blood. Another technique which I would suggest is slowly breathe out of the mouth and close the lips and breathe in through the nose. Even by looking at a video, okay, sex-related video, where 2 people are having sex, a man and a woman, or lesbians, or gays. In all the cases, if they look into the picture and breathe out through the mouth and close the lips and breathe in through the nose, their sexual orientation will change. Okay, so you have to put it to test to see, because I have tried it with several cases like that. They will not be excited because that is a fast learning. What has been learned, quality learning, can be transferred into a new learning. And that is possible only by slowing down the breathing. Okay, it will take about a week's time. giving all these things from morning till evening, okay, then the neuromuscular system comes under control. Then things will be all right. Now, I see Professor Stanley Jayakumar, so he may deliver his chief guest address now. Please. You
Yeah,
have a group now. Please come forward.
yeah. So, okay, shall we, now that he has overcome some kind of technical problem, now he is joined. So with your permission, I would like to
Yes,
introduce
please,
my
please.
good friend. He was heading the department of sociology. And actually, when I was director, he has just requested him to prepare one diploma also, medical sociology. It is a very good course. Just he took initiation and he prepared the syllabus and material with the help of our medical college also, where Sri Venkateswara Medical College, where Dr. Sudhakar Reddy also worked there. So he is quite active. So he is a good researcher, good teacher, good culturally. He is not only active at the campus, but he is also have intact. Okay.
Fine, sir. Fine, sir. Sir, good evening, sir. Thank you for the nice opportunity of meeting you all on screen. And especially, it's my rare opportunity to listen to Ganeshan, sir. Okay. What Ganeshan sir's lecture is, he will make things very light and it will be straight to the point. It will stay straight to the minds of the audience. And especially morning, sir told me that erectile dysfunction will be the topic. So just I would like to share some of my viewpoints within 5 to 7 minutes. I don't want to take much of your time. Okay, sir? And especially when it comes to family. So family is the nucleus of all social virtues. And it is the foundation for all social organizations. When family is loose, it will be like a steeple erected on loose soil. So sexual life is very, very important for any family, for that matter. And especially, what are the strong grounds for divorce? If you observe the strongest grounds for divorce, there are, if a partner is not supporting her for 7 years, or if he is suffering from chronic disease like leprosy for 7 years, if he is not mentally well for 7 years, or if he is not able to take care of his family for 7 years. Okay, so all these reasons will be the strong grounds for divorce. And one of the important grounds for divorce is impotency. Impotency is one of the strongest grounds for divorce. And especially the weapon which is used by girls for easy divorce, in case of any misunderstandings or in case of wealthy girls, for example, the first, if at all, if they want to do away with the boys with whom they got married, the first and foremost weapon they use is that he is impotent. So, as Ganeshan sir was saying, even in Tirupati also, my house owner's son, he's a gem of a lot. And his father was no more, and he took responsibility and he married his sister. So he has celebrated, he has arranged marriage for his sister. She's well settled. When the turn came to him, he got married to a Vizag girl, I think. And that girl is very much attached to her parents. And she is compelling this boy to come to Vizag. And here he is an engineer in PWD, something. He's in a nice position, some assistant executive engineer, something like that. He says that his mother is all alone. That girl should come over here. She says that I'm only daughter of my parents. You should come over there. So it went on for a period of time. And one fine morning, she has sent divorce letters to this boy. Now, what are the points in the divorce letter is showing that he is impotent. So imagine the situation, and this news when spread in entire Tirupati, and imagine the plight of that boy. Okay, so he is unable to, in that situation, he is unable to meet even his own friends, family friends, and his tenants and all. Stating that వాళ్ళ భార్య వదిలేసిందిరా because వాడు important అంట. Then finally they filed a case in court of law. Then legally he obtained divorce. Then got married to a girl from Bangalore. He left to Bangalore. Then from there he went to US also. And he's having very nice, comfortable family life. So one of the essential functions of family is to continue the heritage, number one, and number two, childbearing and rearing. Here lies the important function of the couple, young couple. As psychologists, as a sociologist, my request is pre and post counseling before marriage and after marriage is very, very important. Because as sir was telling, in a small house, for example, if you take slums into consideration, especially the slums in Bombay, I was told that only 3 meters place will be there for one family, and gunny bags will be the dividing walls between one family and the other family, and especially the children will have they will have very nice opportunities to witness the primal scene of their neighbors. When neighbors are in that position, these people will have the opportunity, because only gunny bag is the separating wall between this family and that family. And especially prostitution will be more in slums, and these small kids will be used as pimps or brokers for meager money. And from childhood, he will start thinking about these things. Once he attains his life, once he attains his age as youth, he will become a sexual deviant. A very good example, Erogola Villu, Red Rose, where Kamal Hassan, how he seduces, how he tries to seduce the girls. He will marry, he will kill them. Again, he will seduce the other girl. Again, he will kill. Again, he will remarry. What is the reason for that is ill-treatment by the parents. So his stepmother will be ill-treating him, and he develops vengeance towards girls, and he'll start, he'll seduce one girl, kills that girl, again he'll shift to the other girl. So he'll become a sexual deviant. And we should not watch it as a movie. And it's a nice example even in real lives also. One fellow, Nagarajan, by name Nagarajan in Karnataka, he has married 24 girls, killed one by one after the other. He will marry, he will stay with her for a few days. He will, one fine morning, he will jump, taking the gold and other gold cash and all, he will disappear. And that girl also disappears. And after killing 24 women, then he was caught, and 24 skeletons were found. See the type of sexual deviancy that fellow has developed. So all these things from childhood, we should put our children in a nice track, or else they'll sidetrack from the folkways, mores, customary practices, our religious practices. All India is known as cultural mind. What had happened to our culture? Age-old culture, 3,000 years, for 3,000 years, all the cultures, they have acted and interacted upon each other, and it gave to a nice culture, a nice blend of cultures is Indian culture. What had happened to this Indian culture now? What all we used to listen, what certain number of cases, thereby it will give us immense satisfaction. Thank you, sir, for giving me this nice opportunity. Thank you.
Were quite illustrative cases which you have come across, and really our participant got benefited. They are all real cases.
Yes, sir.
Because it is quite natural, because we are now neither Indians nor Western culture. That means we are in a transition period. During
Yes,
this
sir.
transition period, it is quite natural. All these problems are quite inevitable. So it takes time. Again, it becomes totally influenced with the Western culture, and totally already we have just
Yes.
thank
Thank
you.
you.
Yeah.
Thank you.
Stanley.
Thank you, Ganesh. Sir.
Yes, right.
Thank you, sir.
Yeah.
Thank you very much,
Yeah.
sir. Thank you. Thank you.
Sir, Ganeshan
Yeah.
sir,
Yes, please.
this is Vinusha. So in the previous technique,
Welcome. Now, with regard to the old man having excessive interest and the wife not interested, the solution which I would give is ask her to move her hip and make noise during sex. She will get orgasm because she is inhibited, because she thinks she is old and she has become a grandma and all that. Whatever happens, the human brain and the body is always having youth. So the general prescription would be move the hip and make the noise, the hissing noise. Then she will be happy, she will be interested, and the man has to do it slowly because he is working like a machine. That's the problem. Okay. And the younger people going for divorce and all that, what is important is either a woman may not be interested, but she will be throwing the blame on the man. She will say that he is an important fellow, but actually she will be sexually inhibited and she will be having vaginismus. Her vagina will become tight. See, if you read a book by Irving Wallace, because our sociologist is there, cultural anthropology, Margaret Mead, and Irving Wallace has written Three Sirens. In a tribal community, a girl blames the husband of impotence. And then immediately the people there in the seniors in the committee, like judges, they conduct one test and they find that she is telling a lie and the divorce is granted, but that man is made to marry. But this girl can remain without marriage because she is not interested in sex. You know how they have done it? We have got our one-way mirror in psychology labs or in even medical profession. One-way mirror is there. People will be watching the surgery or watching the counseling, but the people there will not know who are watching. Like that, they have made a kind of improvised technique where the elders stood and watched what is going on with these people. It's a common bedroom. Okay? It's not their bedroom. It's a common bedroom provided by the judges. And they found that the man is, even if the man approaches, she is begging, don't trouble me. And actually, she comes out and says, you are important. Okay. So what is required is they need counseling, not going to police station, not going to the court. Actually, the court should again refer to counselors. But the counselors who are in the court, they are not competent. They are not behavior therapists. Okay. And even psychiatrists are not behavior therapists. Behavior therapy is a different field. It's a upcoming specialization. So if they are referred by the court to behavior therapists, they will solve all problems. Even if your woman is inhibited, she will become all right. The man is inhibited, he will be all right. Okay. Or over excitation, it can be solved. All the things, the central aspect is the breathing aspect. Okay.
So
So
one
that
more thing,
is
sir. One more small addition, sir.
yes, please.
Foreplay. Foreplay is also very, very important, but nowadays, because of lack of time or because of lack of interest or because they may miss one of the important serials.
Yes,
So
doctor.
people are not interested in foreplay. Directly, they are going for that.
Dr. Jayakumar, what I say is, if you want to have a real enjoyment, you should spare some time for that. If you cannot spare time, don't do it. Because foreplay is very important. At least 15 minutes to be spent. Another 15 to 20 minutes spent on information. And then after that, okay, post-coital intimacy, another 15 minutes or about an hour if they cannot spare. Let them go without sex even for months together. Okay. Only then it will be fulfilling sex. If they want to have quickies in the car, in a room or somewhere. That's a wrong style they are developing. The brain will develop that as a habit. Quickies. Quickies are not good. Okay. It is happening among youngsters. It is not good. That sets a
Right,
wrong
right.
style. And
Yes, sir. Yes.
ultimately, they will have premature ejaculation. The man will have premature ejaculation.
And
the
they are having many misconceptions also, sir.
Yes.
They will discuss with each other. If they say that if the husband is not spending much time on that, he is important. Likewise, many misconceptions are there, and we have through careful counseling we can educate them.
I would invite the sociologists also to join and interact and learn some of the techniques so that you can also start trading, because it's a behavioral science. Sociologists can also join and learn these techniques. If you try, it will work. It just works like a medicine or injection, whereas the medicine and injection will not work. These techniques, behavioral techniques, will work with a guaranteed result. Okay.
Yes, sir.
So they
One,
have
one more small addition, sir. When I was discussing with one of my process, it was a rape case, and when judgment came, they gave judgment that he is innocent.
okay.
Then I said, sir, it's a clear case of rape. How they got judgment like that? Then my professor told me, penetration penetration is not rape. Only after ejaculation, ejaculation, they'll consider it as rape. So even in rape cases also, so only after ejaculation it will be considered as rape. When there is penetration, it's not considered as rape. Thereby, that fellow is innocent. See the plight of our girls who are being raped.
Yeah.
So there are certain bottlenecks even in our legal system also, through which these people are easily escaping from clutches of law.
Now, what my recommendation is, premarital counseling is required for the school-going girls and boys towards the +1, +2 level, and also graduates in the colleges. Very simple. Let them ask any question. You give the answer by an expert. Okay, that will
Right.
solve the problem. Otherwise, it has become a darker area. That's
Yes,
the
sir.
whole problem.
Yes.
So many things are
Yes.
happening.
Yes, sir.
Yes, sir.
Sex education is very much important for at high school level and also the pre-college level.
Yeah. Now, for that, I would refer one resource book known as Marriage Counseling. Marriage Counseling by Dr. Jones and Jones, MDs. That gives answers to all the questions, even if the therapist doesn't know. So they can have all the answers for all questions like that. It is both anatomical, physiological, psychological, everything, behavioral.
Put together. Right, sir.
Yeah. And then I want more socialists to practice in India, whereas they are having a roaring practice abroad.
Okay, sir.
Socialists are having very good practice. I know some of them. Mary Golding from US, very famous practitioner in social.
Sir, actually, I have a case.
Yes.
So the man is in marketing field, and the
Okay.
wife is a homemaker. They have been married for 1 year.
Okay.
So they came to the gynecologist in our hospital that they want to get the baby aborted, and she is 14 weeks, and there is a problem in the scan, so they are waiting for the blood report. But the husband is very much wanted to abort the baby because there are a lot of disturbances in their marital life. So when they have come to me, so when I asked, he was talking everything in a statistical way. So he says that the more importantly he points out is I give love, or I spare most of the time. So I want to be more intimate, but she is not accepting it, or she is not allowing me. And this in turn giving a wrong impression to their in-laws that the husband is good, but the wife is not allowing the husband to approach. The problem is, he says that an average person, and I mean like a good couple will have an intercourse for 8 to 10 times a month, and we are not having hardly 4 times a month. And he spends the time, the whole day he spends the time with his wife, and at the night he wants to have the intercourse. The wife says that, okay, I will spend time, but the way he approaches me, I mean like he spends time in everything, but he wants it every day. And that is making me suffocated because there is no romance in that. She's missing that emotional thing in that, and she doesn't want to have that intimacy. That is why she's scared of not allowing it. And he talks everything that I have given this, I have given that, but he wants that recognition, he wants the appreciation, and he wants all the attention. You don't love me, you don't take care. Whatever she does, if she doesn't do any little thing, you don't take care, you won't take. He's utterly not satisfied with the bedtime. And recently when I said, okay, it is her right not to, when she is not interested, I mean, she is pregnant. At the early stages of pregnant, no woman is interested. There is an emotional, I mean, more things will be there, and it is a delicate period of time. So, but recently, in a couple of days back, they had spent good time. And then at the night when she was trying, she was also tired. But when he was coming and she said, she opposed. So he went to the bathroom and harmed himself, like beating on the walls of the room. And he calmed down himself and came and spoken. But the next day when they came, he was complaining that I did all these things, but she is not even doing these things. And he is so stubborn that he's not ready to accept that this one.
Okay.
Everything he keeps in numbers.
Okay. No, I will solve it with the number only. Okay, if he is saying
Yes,
about
sir, I was
number,
also thinking also.
we'll deal with that with the number. What is it? During penetration and performance of sex, your wife should have as many orgasms as possible. If she has as many orgasms as possible. So
Okay.
you do it slowly and take a longer time. First foreplay 15 minutes, and after penetration, at least you should go for 15 to 20 minutes by slow breathing and slow movement. And ask the wife to make noise, hissing noise, and ask her to move her hip in synchronization with his movement. And ask them to alternate different positions, the rear entry, okay, standing, kneeling, man on top, woman on top, all the variety, okay? And then he has to go slowly. He might have given so many things, the gold and the jewel and the diamond and all that. But what he has failed to give is, he is not giving orgasms. Multiple orgasms he is not experiencing. That he can do only if he does things slowly. Slow breathing, slow movement, she will have orgasm, and if she says enough, then he can finish fast. Things will become all right. Okay. It has got something to do with the sexual behavior, sexual physiology, like that. So this will definitely help. You can try that and then come back to us.
Okay. But one more thing is he keeps on pestering things, sir. For little thing he keeps on pestering, because even before the marriage he was pestering. He tried to call off the marriage also.
When you talk about multiple orgasms, you are challenging him as a man. He must be capable of producing multiple orgasms, and if he is able to do that, he will have a mental emotional balance. It's an exercise. If he slowly breathes and slowly performing, you will not need 8 times in a month or 20 times in a month. Okay, and she will be also happy. Otherwise, he is just dealing with her like a machine, and she doesn't feel anything. First requirement is foreplay. Second requirement is slow performance and multiple orgasm. Third thing is spend 15 minutes without getting dressed. Just a hug and don't talk anything, keep quiet. If he does this, it becomes a full program. Okay, even if he does it weekly once, things will be all right. One of the things is what is happening is this kind of traveling people. They have their own company elsewhere, along with friends. Okay, they go to call girls. Okay, and when they come back here, it is almost like punishing the wife. But he has to reward the wife with multiple orgasm. And when a man is able to produce multiple orgasm, that means his mind and emotion comes under control. So you
But
can try the technique.
So what shall I say to the woman, sir? Because she is not even ready.
No, you don't tell anything to the woman. You tell the man. Okay, you perform and 15 minutes foreplay, 15 minutes postcoital intimacy. Okay, and in between you breathe slowly and move slowly, and observe how many times your wife makes a noise. Okay? And ask the wife to make the noise whenever she feels the high. It can be minimum 3. It can be 5. And then he will be also happy that his mind is coming under control. He will not complain. Okay, he will start loving the wife. But now he is only blame throwing person. That's the problem. And he is not performing properly. He is only hurting the wife. That is why she is backing out.
So she is completely.
She
was all in tears.
Yeah.
He was saying she was all in tears, but I'm not able to bear. I'm feeling suffocated. So
No. Why she feels suffocated? Because maybe he is assuming a man on top position where he bears the whole weight on the wife. Ask him to have a rear entry or the woman on top position. So some men engage in man on top position and put the whole weight on the wife, which will be leading to suffocation also. He feels as if he is a child lying on the adult's body. He is not a child. The man must be heavy. Okay, even if he is not heavy, if he puts the weight on the woman by assuming this position, man on top position, okay, missionary position, it is not good. Avoid missionary position. Use the woman on top or rear entry. Things will be all right. Ask him to try.
So what about the person? The man is perfectly well, has erections and everything is good, but he is scared that I may not satisfy, and he is completely avoiding it.
Yeah, you are
And
talking about another case?
Yes, sir, another case.
Yeah, okay. So you say case 2, otherwise?
Yes, sir, case 2, yeah.
Yeah, other people will
Yes, completely, because I have seen many cases like this. They have the complete report or everything is good. Erections are good, he has attraction to his wife, everything is good. But at that when the time of intimacy comes, he completely avoids that. He says that I have headache or I have work and everything.
Yeah.
But he has everything. He has, I mean, like erections are present, and the wife is so disappointed, and the husband says that since we didn't have any close relationship, let us build the friendship first, and then go for it. And that is causing the gap between them emotionally.
Okay. Some guys, they develop a headache or a pain in the hip when they are having sex. Okay. Why they are having it is because they think they are doing something wrong. Okay. So a man wants to become a sannyasi, but still he has to perform sex with his wife. His brain says okay, and the brain says not okay. It's a dirty job. Okay. It can happen to women also. They will think it is a dirty job, then they will have difficulty. Okay. So what to do at that position? You ask him to repeat the name of his favorite god and perform. It becomes a diversional technique. Okay. And sex is also God given. Okay. Females are God given, males are God given, and sex is also God given. So let the man and the woman repeat the name of their Ishta Devata during sex. That diversion will remove this conflict and things will be all right. There won't be pain in the hip or the head, back of the head and all that, they say. Because I have come across a man who is having pain in the lower hip when he has sex, because this fellow wanted to become a sannyasi. okay, or wanted to go and join army because he has got different values. Now he is married and having a daughter of 7-year-old daughter, okay. But his responsibility is to take care of the wife and the child and the father, okay, and then he can do anything. So my suggestion is, because since he is interested in spirituality, let him say Om Namah Shivaya and go on. Or you say about Narayana, 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 Krishna, 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 Krishna. Mind gets diverted and then things become all right. Especially saying Krishna will be all right. Because Krishna is a different avatar, not Rama. Okay, Krishna. Okay, because he is having high creativity, high cognitive flexibility, like that. Okay, that will help. Now, what I say is you have to use your innovation with some logic. But what I say is you try anything, later you will find the logic. Don't look for logic first. Try something. The central thing is diversion. If you can divert with doing whatever nonsense, it will be all right. Because why I say nonsense is, if you follow sense, you are having an illusion. So these are, as I told you, it is a what is known as super intelligence, supra-rational. Rational means logic. Supra-rational means you go out of it. Then you can solve the problem.
Okay. Sir, already we are nearing 8 o'clock. Shall we conclude, sir?
Sir, one last question, sir.
Yeah, who is it asking?
Vinusha, sir.
Vanisha, you have already asked one question anyway. You say
One
with the
last
permission of
question.
the prisoner, with the permission of Professor Govinda Reddy, you can ask.
Okay, Vinusha.
Go ahead. He is always liberal. He will permit you. Go ahead.
Okay, Vinusha, ask.
Sir, what if there is a guilt factor where, the moment they see the woman, even mother and all that, they would get excited, men. So because of that, they would develop some guiltiness, because even looking at my mother too, I am having this and this is something wrong, because they might follow their own religious principles. Like he might be a Christian. In the Bible, it says that we should not do with our parents and siblings and all that. In our Hinduism culture also, it's been the same. So based on those principles, who follow, they might feel very guilty about what they are having. So they will not even, move freely in the society.
Okay. Now what you do is, it is not only sexual excitation, it is arousal. You call it as arousal, psychophysiological arousal. It can be anger. Somebody hates the father or mother. Okay, in this case, what happens is the person gets sexually excited by looking at the mother. Ask him to keep a photograph of the mother and ask him to slowly breathe out and in. Reduce the rate of breathing. Okay, it will gradually come down to 1. That is 30 seconds of exhalation and 30 seconds of inhalation. And once it comes, he will not be attracted to the mother. If he hates the father, he will not hate the father. Okay, so it will balance him out. The central thing is rate of breathing, which you have to give day after day, at least for 2-3 days you give. Okay, and that will really help. You can have the mother's photo in the still and then slowly breathe out and in. Okay, and if he is able to regulate the breathing, then his attachment to the mother will go away. Sexual attachment will go away. But still he will respect the mother. Okay, it can be used in a hatred case also, because they are all arousal only. So you have to define it as arousal. Okay, sex is also arousal, anger is also arousal, revenge is also arousal. So if they reduce the breathing rate, then it is gone. Okay, the lung is clearing out everything from the blood. Okay, but it is not putting it out. So that is what is done by the reduction of rate of breathing. Normal rate of breathing per minute is 15. So if they can gradually reduce it after a day or 2, morning, evening, again, repeat. They develop a voluntary control over the respiratory system, then things will change. Okay, Minusha. Okay. So we can conclude.
Thank you so much, sir.
Welcome.
Sir, yes, Ramadevi.
Sir,
Yeah, you just extend thanks to our Ganesan sir and today's chief guest Stanley Jaykumar and another special invitee. And except me, thank everybody.
Sir, may I have some question? One single question or very short question?
Yes, Kuldeep Verma, tell me.
Yes. Sir, as I read and practiced so many times, there is a three pranayam, Tribandh Yukta pranayam, that is Moolbandh, Udyanbandh and Jalandharbandh. Also on this.
Yeah.
And gives very fast result. Gives very fast result, sir.
The pranayama, light and pranayama by PKS Iyengar, all those things cannot be delivered to a client who is in an urgency. So this is the improvised, innovative, simple technique like a capsule or an injection which will work. Okay. Anything comes under that. I agree with you. Okay. But you cannot treat the person for a month or 6 months.
Yes.
Like a medical doctor, he does the surgery and stitches are done or injection is given, tablet is given, that's all finished. That is what is required by the modern clients. And that is why I have suggested that technique. Okay.
Thank you, sir.
But Verma, have you clarified?
Yes, sir.
Right.
Yes.
Yeah, thank you. Yes,
Thank you.
madam.
Yes, sir. So after I joined, though I joined 45 minutes late, so what I heard or what I know, I will just give a quick brief. So we were talking about impotency or excitation or premature ejaculation or delayed ejaculation or excessive interest. So for everything, the breathing rate, either if it is premature, we have to make it slow. If it is delayed, we have to make the breathing faster and the movement faster. So if excessive interest, the woman also has to cooperate and make hipping by moving the hip movement with the synchronizing of the husband, making the hissing sound, and the man has to perform slowly. So there should be three major things, that is the foreplay and the intercourse time and the post-coitus time, which in which all the three is not there in most of the couples. They just focus only on the middle part of the run and then leave the first thing and the last thing, which is the important thing where we get connected emotionally. So because of the lack of those two, the foreplay and the post-coitus time, it is causing some of the problems in this. So if it is the number, just in the case where the person has said that it is because of he stops in the number, so we have to ask him to see how many times or as many as orgasms he can give it to his wife, so that he can realize what he he can get the emotional balance. So those who have the erections and don't really feel like having the intercourse, they can say that recollect the name of the or chant the name of the Istadaivam or the god and perform it, so that there will be a diversional technique and they can perform well. It's a suprarational. So when the person gets attracted towards a woman, even if it is a mother, arousal can be hatred, arousal can be love or any other thing. So those things can be slowed down by putting a picture of the person and reducing the breathing rate to 30 seconds of inhalation and 30 seconds of exhalation. And slowing down the breathing rate really gives a good lot of amount of oxygen to the brain, and the cognitions also make it clear while doing it. Even if we do even if we are in a hurry, if we slowly breathe and breathe out, we get an idea. So the rate of reduction of breathing helps in many of the cases, and I have done it, and most of the cases were successful. So that is more important. So breathing, reduction of the breathing is the key in this aspect. And I would like to thank Ganeshan sir, Stanley sir, and Sunanda ma'am, who has been here for spending their valuable time. And I also thank Vijay Reddy sir for providing the platform. And today was the 24th session, and we are rushing. We have 5 more sessions to come up. Then I hope at least those who could not join should join to make the time so that they can listen something and train themselves so that they can use these techniques in their counseling practice. So thank you one and all. So have a pleasant evening.
Thank you, sir. Thank you, Manandal.
Thank you,
Thank you, sir.
Tomorrow, good evening.
Thank you. Good night, sir.
Thank you.
Good night.
Thank you.
Good night, sir.
Thank you, sir. Good night, sir.
Sir, good night.